And I am a second year nursing student at Deakin. This video focuses on the management of the patient in the immediate post-operative phase. If a patient has undergone surgery requiring anaesthesia, once completed, the anaesthetic agents are discontinued, monitors are disconnected, and the patient is transferred to the post-anaesthesia recovery unit. In this unit, the patient is monitored by a PAR nurse. This nurse has a number of roles. The first one is receiving handover from the anaesthetist regarding the patient's care. This should include a summary of the operative and post-operative period, vital signs, assessment of comfort, and assessment of the surgical wounds and drains. Maintaining the patent airway and maximising ventilation are the main priorities of the PAR nurse. The nurse must assess the airway for possible obstruction to determine if the patient can protect their own airway. The patient must also have adequate oxygenation and ventilation, which is achieved by supplementary oxygen via nasal prongs or an oxygen mask. The patient will remain with this oxygen until they have left the ward and may continue on in their new ward depending on their oxygen saturation. Positioning of the patient is also important, as they must be positioned in a way that their airway is not obstructed. In addition to maximising optimal oxygenation, other goals of the nurse include promoting fluid and electrolyte balance, maintaining body temperature, and promoting comfort. This is achieved by providing blankets if the patient's temperature is low, or possibly removing blankets if they become febrile. Often patients can become dehydrated post-surgery, despite being hydrated in the intraoperative stage. This is overcome by putting the patient on normal saline IV fluids. This is also vital if the patient experiences vomiting or diarrhea post the surgery as a side effect of the anaesthetic, as lost electrolytes and fluids need to be replaced. The nurse must also evaluate the incision site to ensure that the sutures are holding and the wound is healing. They must also identify possible infection and administer antibiotics if complications arise. Because patients are more vulnerable to illness after a surgical procedure, nurses must watch for signs of pneumonia or easily transmitted ailments such as staph infections. It is evident that the PAR nurse plays a vital role in the post-operative phase of the patient's surgery, and there must be effective communication between themselves and the people they are receiving the patient from, so that all information is successfully conveyed.